In this video, we discuss treating sleep apnea with the RFA procedure. During normal breathing, air enters the nose and mouth, passing easily through the back of the throat, also called the pharynx. The area behind the tongue base is called the posterior airway space. When we sleep, the tongue muscles relax, resulting in a narrowing of the posterior airway space. In patients with obstructive sleep apnea, the tongue relaxes so much that it completely obstructs the posterior airway space. CPAP is the first-line treatment for sleep apnea. For patients who are unable to tolerate CPAP, the radiofrequency ablation procedure, or the RFA procedure, can effectively treat sleep apnea. The RFA procedure addresses the obstruction which occurs at the tongue base. The RFA procedure is performed in the office while the patient is sitting in a chair. First, the throat is numbed with an anesthetic spray. Then, Novocaine anesthetic is applied to numb the tongue. A special probe then delivers radiofrequency energy to the back of the tongue. After the procedure, the deep tissues in the tongue contract and the back of the tongue shrinks and becomes less flaccid. This results in a more open posterior airway space. The RFA procedure is then repeated 1 month later, resulting in a continued reduction of the tongue base and a further opening up of the posterior airway space. Radiofrequency energy is applied to the tongue base in low-dose increments. Approximately 6 RFA procedures are performed during a 6-month interval. This gradual treatment approach makes the procedure very safe and very well tolerated. At the conclusion of 6 RFA treatments, the posterior airway space is opened, eliminating the obstruction which occurs with snoring and sleep apnea. The RFA procedure involves no cutting and no tissue removal. There is minimal discomfort and no downtime. The procedure is very well tolerated and has an excellent safety profile. The goal of the RFA procedure is to be cured of sleep apnea, so the patient can breathe freely and sleep soundly without the CPAP mask.